Hey everybody. I think you can see me. I hope you can. We're going to talk about professionalism in medicine. So I will tell you that I borrowed this particular slide presentation from someone else, but it is a great presentation on professionalism in healthcare. We'll do professionalism and then ethics and law. One of the great things about this particular slide is it refers to the physicians a whole lot, but really every healthcare professional is held to the same standard. So I want to be sure that you know that all healthcare professionals are held to that same standard. We really are. And so we just have to be careful and be mindful that what we're doing is, we continue on down that road. Okay, so we are going to get started here, okay? So at the time we finish this part of professionalism, you guys should be comfortable with understanding what professionalism is, what constitutes professionalism, and how to measure your own professionalism. Are you being professional or are you not being professional? What behavior constitutes as professionalism? So does it make any difference? Does it make a difference if we're professional? Think about when you go to the doctor. It does matter whether the people taking care of you are professional. It helps you have trust and faith in what they're able to do. Healers and professional healers are can be different things. Sometimes healers are people from a specific faith. They may have shaman, or they may have different religious or cultural healers, and that they see before they actually see a physician or a healthcare professional. So those people are generally caring and they're insightful. They pay a close attention to what people are talking about. They're open-minded. They're respectful of others. They respect the patient's dignity and their autonomy. Autonomy means their right to make choices. And their presence is comforting. And so that's important. A professional person can work autonomously. That means they can work based on their scope of practice, or what's okay in their regulatory issues. Their regulatory base. Like a doctor can do things that a nurse can't do. A nurse can do things that a medical assistant or a nurse aide can't do. That's autonomy. That's what that means. Self-regulation. They have to be able to understand what they can and can't do and do it to the best of their ability. They have to know what they can do based on where they're working. So you may be able to do one thing in one location, but maybe not necessarily to another. As a healthcare professional, we have a responsibility to society to behave professionally at all times, but also to do the best work that we can without harming others. And as a healthcare professional, we work in teams. No one does it by themselves. Now, things that overlap in this Venn diagram that are important are things that we both have to be capable of. Whether you're a healer or you are a medical professional, you have to be competent in what you do. You have to have a knowledge base. You have to really understand what you're doing and be competent. You have to be committed to patients and committed to providing the best quality care that you can. You have to protect the confidentiality of your patients. You can't go and be talking about patients or people that you've taken care of out in public. You can't tell your family. You can't tell other people about what's happened at work or what's happened in your clinic. Altruism. That means that you put others before yourself. You have to make sure that someone else's best interest is taken care of before your own. All medical professionals need to be trustworthy, be honest, and have integrity. Follow a code of ethics based on what their profession is. They have to be moral and ethical. So they have to understand and there is a difference between morals and ethics, and we will go over that. But you have to be morally correct, and you have to have ethical behavior. Also, you have to be a responsible professional. You have a responsibility to do the best you can to be the best medical professional that you can. Here are some definitions of professionalism in medicine. They require not just a physician, but any healthcare provider to serve the interest of the patients and the community above their own. Also, you have to have that sense of putting others before yourself. You have to be accountable. You have to strive for excellence. Feel a duty a duty to others. Be honorable, have integrity, and respect for others. And I give examples of things that are follow along those lines. You want me to if you come into the ER and my shift is ending as a nurse and you need help, you want me to stay and help you as opposed to go home and taking care of my own interests or taking care of my own things. That would be that altruism. Accountability. If I make a mistake, you want me to go and say I made a mistake, and then you want me to be held accountable for that. You want to know that if I'm not respectful and an honorable person, that there'll be consequences for me related to that healthcare profession. You want me to be the best that I can be. You want me to be the best nurse that I can be. You want me to be the best whatever healthcare provider. You want me to strive to do that every day. You want me to have a sense of duty so that I feel like I need to do my job, and I need to it's not just a job. It's why I'm here. It's a calling. It's something that we choose to do. We want to make sure that we work with a sense of honor and integrity. And integrity is actually doing the right thing even when nobody's looking. And respect for others and respect for yourself. One of the things I talk to my classes in class about, and then we will record this after this, but one of the things that we talked in class about is we talked about how important it is for healthcare professionals to think about starting today, thinking about your how you present yourself to the world. Social media is such a huge part of everyone's life these days, but I can tell you, as someone who used to hire and fire people, I have not hired people because of their social media. I've terminated people because of their social media. When you work in the healthcare field, just like being a teacher, what you do matters whether you're at work or not. I gave an example of for a while before I left my previous job, we were looking for a pediatric nurse practitioner, and we had a lot of applicants, some really remarkable applicants that we passed on because the interview panel went and looked them up just like anybody else would on social media, and some of them had some very unflattering images. Maybe they were drinking, they were holding about alcoholic beverage. Maybe they were dressed very inappropriately. Maybe, just all kinds of things that they were images that were being put out on Facebook or Twitter or Instagram. And because of that, we chose not to even interview them. Now, you may say, well, that's my own personal time, or I wasn't working there then. It matters. Those footprints that you leave today on social media are there forever. And it's really not hard to go back and find those. So you want to be sure that what you are putting out in social media is appropriate, that you're not bashing people, that you are being positive, and that you're being a role model. Because even today, someone may look back on your Instagram from, if you're a senior in high school, they may look back on your Instagram for not just college, not just a job, because they do that all the time, but they also will look back for scholarship money, They'll look at it for entrances to college and for colleges of medicine, colleges of nursing. They're going to look to make sure that even if you were that 4.0 student who was who was phenomenal in school, if you put negativity or you put inappropriateness out in the world, then how successful or how are you going to represent that university or that scholarship program? So please think about that as you move forward with life, that sometimes the best thing to do is just to be sure that you don't put it out where everyone in the world can see it, because it can come back to bite you. And talking about terminating people for social media, I've had to terminate people for their social media because they said negative things about. They didn't say where they worked, but they had the place that they worked posted as where they're employed, and they would just post on there, post a video saying how horrible work was today and how everybody's stupid and how nobody knew what they were doing and patients were horrible. Well, people see that and they turn it into human resources. It may be your coworker, it may be someone in the community that sees that. So be careful about that when you work as well. You don't want to be negative about the place that you work. If you have a policy that says don't take a picture at work, don't do selfies at work. If there is they have a policy that says that you cannot be participating in unfavorable behavior in anything that has your employer's logo, your hospital logo or clinic logo or whatever on it. Don't go out with friends and have drinks and be behaving inappropriately and have a t-shirt or a jacket that has the hospital logo on it. And literally, I've had to terminate people for that, or I've had to write people up for that. So be careful. Be careful with those things as you move forward. That goes back to integrity and respect. And so that's a way that they can get around hiring you or get to a place where they can terminate you, because a lot of times it will violate their code of ethics or their value system. And those are the easiest ways to lose your job, is violating your place of employment's value system. So let's talk about professionalism as a role of a healthcare professional and how you can kind of develop that as you go. You need to understand where you work. Once again, back to that value system, code of ethics. Every place you go to work in the healthcare world will have a mission statement. So you want to know what the mission statement is. It's always good on in interviews as well, if you know the mission statement and their code of ethics, to reference that in an interview or ask questions about it. But know that the place that you go to work with, read those things before you interview. If you don't think you can live up to their expectations or you don't agree with them, don't go to work there. Don't interview. Don't waste your time or their time. Understanding clinical responsibilities. Knowing that you have to be dependable. That if you're scheduled to work, you need to show up. Know that if you are scheduled to... if you're going to fill in for someone, don't say you didn't remember. You have to do what you're supposed to do. Also, know what is expected of you. Know what your job description is. And in that job description, make sure that that job description falls within your scope of practice. Scope of practice are things that you are legally able to do under state law or under your licensure. So like as an RN, I can start IVs. I can give certain medications that like an LVN may not be able to do. I can hang blood. I can administer blood. I can initiate blood, and LVNs can't initiate blood in the state of Texas. So just knowing what you can do. Just having an appreciation that you have to be a lifelong learner and a researcher. You have to know that you're going to have to look things up. You're going to have to learn every day, because healthcare changes minute to minute. So you have to stay on top of the game. So you have to be a researcher. You have to be looking for what's coming. You have to figure out if things work or they don't work. And if they don't work, figure out what would work for your company. Because one thing that you can do, and it's one way to earn the respect of a supervisor, is if you have an issue, go to them not only with the problem, but think of some ways to resolve it, some legitimate ways to resolve it. Not if you can't get along with someone, I want to move or I want them fired. That won't work. But how could you sit down and talk with them? Go to them with legitimate ways to solve problems. Also, know that as a healthcare professional, you're a mentor. There's going to be new people coming in. Hopefully, there'll be someone that mentors you when you start a new job. But in turn, when someone new starts a job, you're going to be a mentor as well. People are going to look up to you. People are going to have high expectations for you as a healthcare worker. You're an educator as a healthcare worker. You're constantly teaching people how to take care of a wound, how to take care of their medicine, what's wrong with them, what the disease actually is, and how it's going to affect their body, what to do if they can't afford a medicine. You're constantly teaching people in the healthcare world. You also have to appreciate quality control. We have to be constantly thinking about how you manage supplies and equipment and utilities, everything that goes on. So I'll tell you 2 things my dad told me when I was really young. He said, first thing you have to do is when you go to work somewhere, when you work there like you own it. If you own something, you're going to respect it, you're going to take care of it, and you're going to be conscientious with it. You're going to be a good steward. Stewardship is taking care of, being mindful of money, being mindful of resources. So be mindful of resources, because when we're mindful of resources and we don't overutilize, that's how we also get financial rewards. We get raises. Whereas if people are wasteful, then that causes places to lose money and we don't get raises, or we actually take pay cuts, or we lose staff. So we have to be very mindful of quality control, of the quality of, not just the quality of work that you do, and not being honest when there are errors, but also of taking care of what we are doing. And then the last thing that's so important in healthcare is teamwork. You can't do anything in healthcare by yourself. You just can't. You have to have people to support you, to work with you. And if you don't get along with people, and you can't get along with people, and you can't get along with people that you don't like, healthcare may not be the road for you. We have to, as healthcare professionals, constantly work with someone. And we don't always like them, but we can be respectful and get our job done. And that's what's expected as a healthcare professional. Things we can do for personal development: always be willing to learn something new. Don't ever be stagnant. Know that there is always something new coming down the road. Be that researcher. Know what's coming next, and be on the forefront. Be self-aware. Know what your limitations are. Know what you know what you don't know, and if you need to learn it, learn it. Also, being self-aware of the fact that maybe you shouldn't, maybe you've worked too many hours, maybe you haven't slept enough, maybe you're not well physically or emotionally, and you shouldn't be at work, because you could be putting someone at risk. So be self-aware. Be confident. Be confident in who you are. Be confident in your personality. Sometimes it takes us a long time to get there as human beings, but that's okay. You can fake it till you make it. That's for sure, as far as confidence. Now, do you go in and do things you don't know how to do? No. Is it okay to tell a patient or someone, I'm not sure, let me check on that, or I'm not sure, I've never done this procedure before, or I've only done this procedure a time or two, I want to have someone come in with me? People respect that. People will respect you if, I used to start central lines in the emergency room. PIC lines. I used to start PIC lines, not central lines, sorry. I used to start PIC lines in the ER, in the ICU, the hospital I worked in quite a few years ago. The first few times I did a PIC line, I did them successfully, but for my own well-being, I wanted someone there for moral support. I wanted someone there to make sure I was doing it right. That's okay, and I never had a patient look at me funny or have less respect for me, because I said, I've only done this a few times. I'm confident. I can do this. I'm comfortable in doing this, but I just want someone there with me. Or if you haven't done it before, be honest and say, I've not done this before. Let me get someone to help you. Be confident in that it's okay not to know everything. Self-regulation is kind of a big thing in healthcare. We have to have we have to take care of ourselves. Can't take care of anyone if you're not well. So resting well, eating well, getting exercise, not coming to work in a situation where we might be impaired. Also, self-control is a big deal. As a healthcare worker, you're going to have people that love you, and you're going to have people that hate you. You're going to have people that will get in your face and yell and scream and throw a fit, and you just have to remember, stay in control, and remember that there's a reason that person is upset. Try to talk to them calmly. Don't let yourself be abused, but talk to them calmly and say, I respect that you're upset. I do. I respect. Don't say you understand, because you may not, but you can respect that they're upset and say, could we sit down somewhere calmly and speak? That's okay. I mean, I've had people scream in my face. I've had people yell and cuss and spit at me. And in that whole time, I have not yelled back at a patient. We have to remember that when we're taking care of them as a healthcare provider, they have issues, whether it's physical or emotional or mental. They have issues, and we need to respect that and try to work with them. We have to always be working on time management. I work on it regularly, and I will be working on time management and probably with my last breath. But that's okay. Just know that everything in the healthcare world is time sensitive, and so we have to be able to do multitask and do lots of things at the same time. Motivation is really important. That drive to do better, that drive to be the best, that drive to do what you love. Another thing my dad said besides work like you own it. The other thing is he always told me that to do what I love, do what you love. When I was about 7, I used to have to go and we had this little we had this little thing called the land crawler, and had 2 little joysticks, and it went really slow, had 6 tires, and it went across from about 5 acres of land. I'd have to drive that at 5 in the morning over to where we had a bunch of bottle calves. I grew up on a ranch my whole life. Drive all the way across, feed these 5 or 10 or 15 bottle calves, however many we had at that time. They were usually dairy calves that had been taken off of their mom, or maybe one's mom had died at giving birth or whatever. But we had these bottle calves, and I'd have to go over, mix the milk up, hang them up when I was 7 or 8, feed them. Then I'd have to take the bottles out, clean them up, and get them ready for the afternoon when I'd have to do it again. And one morning it was cold. It was probably November, December. It was really cold. We were still in school, and I just told my dad, I'm like, I don't want to do it today. You do it. And he said, no. He said, this is your responsibility. This is your chore. You're going to go do it. But I'll tell you this: if you don't love doing this, then do what you love. Get an education to where you can do what you love, because if you do what you love, you'll never work a day in your life. What he meant was you'll love what you do and you enjoy going to work. But if you hate your job, if you hate what you do, then every day you have to go to work and do that is like working a whole lifetime. So I've been very fortunate that I've been able to love what I do for the most part. I had one job as a nurse that I really didn't love, and that's because I worked in an unethical type of environment. I worked my contract and then I moved on. But everything else I've done in healthcare, I've been so fortunate to work with wonderful people and with wonderful patients. So I've really loved a lot of nursing. I've had some times that I didn't like what I was doing at the moment, but I loved what I've done. And then as a teacher, I've really enjoyed being a teacher and really kind of loved giving people healthcare knowledge, and to decide if this is what you want to do. Could you have the same passion I have for nursing maybe, or for healthcare, and be able to make that choice. And if you're not going to do it, then you don't waste college money, trying to do something that you're not going to love. You have to be committed to anything you're going to do in healthcare, because I don't care what you do in healthcare, there's never enough money to pay you. If you love what you do and you are really, truly committed and you have a lot of initiative and you are working your heart out for patients, they never can pay you enough. But it doesn't matter, because you love what you're doing. It's kind of like teaching. Teachers don't make a lot of money. They don't. But I don't know many teachers that don't love what they're doing. They don't love their kids. It's funny. Even though you're not here with me, I still call you my kids. Y'all are my kids from whichever school you're at that's seeing this today. whichever school it is, but y'all are my kids too. And that's kind of how I refer to all of you. I'm very fortunate because for the first time since I've been doing this is my third year, I'm actually going to get to go to all of the schools and see all of my students this year. So I'm excited about that. So I actually get to see you, and other than just kind of looking at this little eyeball camera I have here and doing that. And just make sure you make the right career choice. You want to make sure what you're doing is the best for you. So elements of professionalism, these really are just vocabulary words that you can look up, but do know altruism and accountability, excellence, duty, honor, respect for others. Those are vocabulary words that you can look up. Now, 10 commitments of a healthcare professional. I know it says doctor, but these are things that every healthcare professional should strive to be. First one is competent. Be competent in what you do. Know what you can do. Know your limitations, and do it to the best of your ability. Don't halfway do anything. And that's in life, period. Don't halfway do things. Get out there and work as hard as you can. Trust me. It never goes unnoticed. Hard work never goes unnoticed. Be honest with people in this life, and be patient, and be honest with your patients. The worst thing you could do to a patient is lie to them. It's okay, like I said, not to know, but find somebody who does. Don't tell them if it's going to be okay if it doesn't. Don't say you understand if you don't. And that's kind of a funny thing, because we always kind of think about telling someone, yeah, I understand. I don't tell patients I understand. I tell them I respect your feelings, or I know that this is hard, or I can tell that you're grieving, or I can tell that, I'm sorry, guys. I forgot to turn my phone on vibrate. So just be honest with patients. You also have to respect confidentiality. We can't talk about patients outside the work environment. And we only talk about patients with people who really need to know. If you take care of a patient that's ill, the only person you probably need to talk about that with are the people who have direct care with that patient. You don't need to tell the secretary, the receptionist up front what was wrong with that patient, because that's not important for them to know. Be sure that you maintain appropriate relationships. And what that means is be respectful, be kind, but don't overstep. Don't become too personally involved. And that can be hard for healthcare professionals. We don't date our patients. We don't date it's best not to date your coworkers. That could go wrong. But, just make sure that relationship is appropriate. And appropriate also can be if you don't really, people have personal space. Some people don't mind you being in their personal space. Some people do. So that's another thing, is just maintaining appropriate personal space and respecting their wishes. Improving quality of care. We always want to try to do better. Every day we want to do something better. We want to provide better care for patients. So always be striving to improve the quality of care that you provide. Improving access to care. Find ways for people in your clinic or your hospital or wherever to get better care, to get more care for their dollar, more bang for their buck. Trust me, healthcare is so expensive. If we can give better access to care, give them information faster, or give them things that they need quicker, then that's what we need to try to do. Be sure that you the resources that we have, if you have a limited amount of resources, use them wisely. Don't just give everything away no matter what. You want to be sure that you use your resources wisely. Things that you can't get back, things that are not renewable. You want those finite, those resources that can run out. You want to be sure you use them wisely. Also, be sure you understand the science behind what you're doing. I gave an example. If I come into a hospital room to give you a cardiac drug, maybe I'm going to give you, digoxin IV. You want me to know what that does. You want me to know how it's going to affect the body. It's for people with atrial fibrillation. It can be given by mouth or in an IV. And if it's given in an IV, we have to push it slow so it doesn't irritate the heart rhythm. we want it to reset it, but we don't want to make it stop. So we push it very slow. But you want me to know if I'm going to do something to you, you want me to know why I'm doing it. So that's that scientific knowledge. Know why you're doing what you're doing. If you don't, look it up. Maintaining trust by managing what you're doing. You have to maintain trust with patients, with your coworkers, with your employer. You have to do that. You have to maintain that trust. Also, professional responsibilities. It's not just about showing up to work. It's about working to the best of your ability. It's about volunteering when you can. It's about maintaining your license. It's about maintaining as a nurse. If I violate any law other than a speeding ticket or a moving violation, I have to notify the board of nursing immediately, and they determine whether or not I get to continue being a nurse. So you have to be sure that as a professional responsibilities that you're mindful of those. Know what's expected of you in your profession, and just do what you're supposed to do so that you don't risk all of the years of education because you made a mistake or because you didn't think things through. So we're going to skip the professional medical student. But I'm gonna take a minute just to go over, because there's a couple of things here I really like that are for students, period. Respect your teachers, your preceptors, and your peers. Your peers are the people in class with you. Your preceptors are people that you may be working with if you go do clinicals or things like that. Professors are just your teachers. Be respectful to them, because someday you may need to ask them for a letter of recommendation. They may be hiring you one day. Be respectful. When there are guest speakers, and if you're visiting in a clinic and there are patients there, be respectful. Ask questions, but be respectful. Be sure you respect your school. You represent your school every day. Most of you have a t-shirt or something with your school logo or your school on it. If you're wearing that, remember you're wearing it, and be respectful and be appreciative of your school. Be supportive. Be supportive of your school. Be supportive of your classmates. Be supportive of your teacher. Those are things that help get you ready for that professional environment. So I'm going to talk about lack of professionalism really quick, and then we're going to stop for the day. You're going to have an article to read, and then, but when we get to that point, I'm going to tell you what I want you to do. Okay, so things that happen that cause a lack of respect to any profession would be abuse of power. So if you are rude, hateful, derogatory, inappropriate when dealing with patients or other team members, that is an abuse of power. Showing bias or some kind of harassment, breaching confidentiality, that's an abuse of your power as a healthcare worker. Being arrogant. Everyone has started somewhere. No one is too good to do anything, and everything in a healthcare facility's job belongs to you. I'll talk about a little about, you'll hear me talk about my dad often. So my dad did not deal with arrogant behavior. And he didn't deal with arrogant behavior because my father was a very, very smart man, but he was unable to read or write. He had to quit school in the 3rd grade, and he went, I've got a picture somewhere. I need to bring that and show that to you guys sometime. But he was 9 years old, standing on a milk crate, washing dishes in a restaurant 40 hours a week from the age of 9. He instilled a love of education in us because he was not able to do that. And if we ever got to a point where we thought we were better than someone else, he would look at us and say, "Who do you think you are? You come up from a home of an elementary school and a high school dropout. Who do you think you are? What makes you think you're better than someone else?" So he was he kept our ego in check. I was pretty smart as a kid. I had some successes in ag because I was an ag kid. But he made sure that I was kept in check. And that's okay. Just keep yourself in check, because arrogance is not there's no place for arrogance in professional in the healthcare profession. Arrogance gets people killed. It really does. Greed, once again, do not go into healthcare for money. Just don't do it. You work too hard. You work too hard to get there. You go work too hard once you get there. You have to love what you're doing. Greed never got anybody anywhere either. Don't misrepresent yourself or what you're doing. If you're a nurse, say you're a nurse. If you're a medical assistant, be proud that you're a medical assistant. If you're a nurse aide, be proud that you're a nurse aide. But don't represent yourself as something that you're not. Don't mislead people to think that you can do things that you can't. Be truthful. Just be truthful. Other things, don't work if you have an impairment. You know, if you're a healthcare worker, the last thing you need to do is stay up for 2 days straight and then try to take care of people. It's like trying to take a test and you haven't slept or eaten in 2 days. You can't do that. You're harming yourself and others. Be sure that you're conscientious about what you're doing. Be sure you're able to fulfill your responsibilities. Don't overstretch. So that's hard in high school, I know, because you want to play sports and you want to be in clubs and you want to be in other activities and you've got all this schoolwork. And so you feel sometimes that you're stretched so thin that you could see through you. But just pick what's important and do what's important. Make sure you don't have conflicts of interest. So that would mean that's an unethical type of behavior. That would be like for a healthcare provider, we're not supposed to take care of our family members. We may do things we shouldn't do. We may not treat them the way we would treat everyone else. So we want to be sure that that emotional bond we have with a family member, whether it's good or bad, that it doesn't cause problems. So that would be a conflict of interest. It's also a conflict of interest to accept gifts or money outside of normal payment for things. We don't take money or gifts from patients. We don't take money or gifts from drug reps or other things like that. We want to make sure that we're doing what we're doing because healthcare is what we love. Okay, so I'm going to stop there, and we will pick back up with how professionalism can be implemented. How do we implement professionalism in our workplace and in our life? Okay, you guys, have a wonderful day, and I will see you soon. Thank you so much.